What's up, everybody? Welcome back to this week's edition of the On Purpose podcast, where it's our pleasure to show up with you each and every week to get you thinking, get you moving, get you wondering maybe, or just what about this? What if our job is just to remind you the importance of living life with a little bit of curiosity, a little bit of, why did our paths cross? Why did this person come in my life at this point? Why am I hearing this thing now? Why am I reading this book now? Being a little more curious and see where that leads us. And I'm excited that you're here with us. I'm excited you're curious enough to have been with us for 6 years. And thank you so much for being in the community. Otherwise, it's just me talking to myself, and Lord knows I already do that enough. So this week, I'm excited to be joined by a visionary in preventative healthcare, someone who is transforming the way we think about heart health, longevity, and leadership in medicine. Dr. Dave Montgomery is a board-certified cardiologist, health educator, and the founder of Prevent Clinic, Inc., a practice dedicated to preventative cardiology and primary care. With both an MD and a PhD in physiology, Dr. Montgomery has spent his career not just treating patients, but what I'm really curious to learn about today and why I brought him on the show is one of his missions is to empower them to take charge of their health before problems arise. So you know how I feel about workouts, you know how I feel about diet, nutrition, and just constantly moving our bodies and our minds and our spirits so that we see whole health, right? Health as a whole thing, not just something that's responsibility of the medical profession. So I'm excited to bring Dr. Dave Montgomery on the show. But before we do, I got to ask your help. Get over to your favorite podcast apps, YouTube, like, subscribe, share. Help us reach more people around the world. Remember, our mission is to be one of the most impactful podcasts in the world. And to reach more people that maybe need to hear some of this is we need your help. So please do that, and then sit back and let me know what you think about our interview today with Dr. Dave Montgomery. Dr. Dave Montgomery, welcome to the On Purpose podcast, my friend. I can't tell you how excited I am to sit down and talk with you.
Man, I am equally excited to jump into this. I was looking at all the YouTubes, all the fantastic guests that you have, and I was thinking to myself, boy, I better think of something really good to say. I mean, it really is an honor. I know it sounds like platitude, but it really is, especially given what you're about, and hopefully I can add something to the conversation.
Oh, no doubt you will. And I wanna thank you. First off, I always like to thank my guests, especially when they're doing something like you are, which is breaking the norm, getting outside of maybe the traditional message and really getting people to empower their wealth before they have to come see you.
Yeah, yeah. No, it's a critical piece. I think everybody, when we say we should be, preventive, right? It makes sense to a lot of people, and it smacks as true. But unfortunately, we still don't operate like that. We certainly don't operate like that in American healthcare. It really is reactionary, and as much as we want to change that, it is like changing a big ship and trying to turn it. It's a big stodgy thing. It takes a long time to turn that ship around, but I think each little bit counts. The name of my clinic, Jared, as you know, is Prevent Clinic, as in prevention. And we emphasize the PRE in the typeset on purpose because we want to get there before events happen, before one becomes so ill that you're in extremis. And that's the name of the game.
Yeah. And I love what you said there, that analogy of turning the ship, because that first turn we make on that wheel of the ship, we don't even notice we're moving in a different direction.
Yeah.
But if we keep turning it, eventually we're heading in a new direction. I think that's such a key thing for us in the medical field, and how we empower our health is not to look for an immediate result tomorrow.
Yeah. 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 No, that's exactly right. And to further the metaphor, boy, if you stop before you can, see the outcomes because you turn that wheel and boy, nothing's moving, you can't perceive a change. But in fact, underneath the surface, the rudders are doing whatever it's called. They're moving and they're trying. But if you stop the turn before you can see it on the outside, then you miss it. And that's also a part of this. So this is such a great analogy that we're using, and it applies directly to how we function in our physiology. So
Right.
It's great. Yeah.
Yeah, and I think it's called momentum, right? It's building momentum. Whatever we do in life starts with one little action, not a giant leap. And with that in mind, I got to warm you up. We can't just deliver this big content to people right away. I got to make sure
Yeah.
our hamstrings are nice and loose.
Yeah, I know, right? Straight to business. Boom.
Let's go. All right, Dr. Dave, you ready for your warm up?
Yeah, let's do it.
All right. What are you going to choose? Sunrise or sunset?
Oh, I'm a sunrise guy.
Why is that?
Well, so I don't know what it is about me, but I have the most energy, the most ideas in the morning. In fact, even before the sun rises, but if I had to choose, I just am on in the first part of the day. I get up at 4:45 to work out on, 3 days a week. I get up at 5 o'clock on the other days, not just because it's a task or a chore or responsibility. It's just because I'm ready to get started. I'm anticipating, what I can accomplish in this day. And I'm just excited about life. So, getting up and doing that in the sunrise, that's for me.
Oh, I love it. What's a quote that stuck with you throughout your life?
Oh man, there's so many. One that is with me right now is by William James, who is also a physician. I didn't know he was a physician until recently. So William James is a writer whose writings have just sort of spanned time. And he says, compared to what we ought to be, we're only half awake.
Oh,
That the human individual is only using a part of his mental and physical abilities. That stating the thing broadly, he says, if we could only use the capacity that we have, boy, we could accomplish some fantastic things. I think that applies broadly to, very many things. And I broke up the quote a little bit, but that's what it is. We're not even half awake, as to what we can do. So when it comes to AI and all these other things, we're only just getting to the surface.
oh, powerful. What's a song that's stuck in your head or on repeat in your playlist?
Oh, right now, I'm going to cheat. And well, so here's what I'll say. So very often I'm not listening to music. So just to be, full disclosure, I'm listening on Audible to Beyond Entrepreneurship, Jim Collins. There's a 2.0 version. And then on my Apple Music is The Science of Being Great by Wallace Waddles. So that's actually on repeat quite a bit. And I actually like Eliza Foss's narration because she really just knows how to sink it in. So that's what I'm listening to.
Very cool.
It's not music though. Yeah.
That's all right. Favorite book?
My favorite book right now is Resurrection by I'm good. Neville Goddard, and Resurrection was written a really long time ago, but it's really about your power of imagination, the power that you have to think a new thought, to have a new experience in life, and it's rich. I read it over and over again. It's like dog eared. It's like falling apart. But
Really?
Resurrection.
Yeah, I have
Neville.
to add that. That's
Yeah.
honestly, that's one of my favorite questions of all the guests because I'm always looking for something else to read.
Yeah.
And I just piggyback off what they're telling me. So that's going to
Yeah.
move to the top.
And it's a quick read. It's small, but boy, that thing gets used up. It's a small book, but boy, it packs a punch. So
Oh, I love it. All right, Dr. Dave, one last question. You get to have
yeah.
dinner with somebody. They could be with us or have passed on. Who would you have dinner with and what would you want to ask them?
Yeah. So what would I want to ask Neil deGrasse Tyson? Oh,
Oh.
boy. I mean, this guy, I don't know where he comes from, man, first of all. Because you know what I think of, physicists in general, astrophysicists, that whole thing is that they have a different concept of life and what we really are. So you'll remember Einstein, kind of, took us into a different way of thinking about matter. He said, there is no matter. What we call matter is just energy whose vibration has been so lowered as to be perceptible to the human senses. There is no matter. I just think the physicists, I think they think about life differently. So yeah, I want to hear about planets and what they think about what's out there, but I want to evolve my thinking about what we're here for. What are we doing? And the truth of the matter is, there is this through line for all of us. No matter what the divisions are, we're just all really the same energy. The quantum physicists have it right. It's the unified field. right?
Yeah.
It's manifested in the Matrix. Remember in the Matrix, right? The first one, where Neo, right, when he really figured out who he was, he turned into this just field of energy. Think about it.
Right.
And once he did that, here's the message, I think. Once he got beyond the surface of the humanness and got to truly who he was able to do some super, like some phenomenal things. If we could just get past the things that we use to filter us away from each other,
Mm.
we could do some phenomenal things. And I think it'll eventually will happen.
Yeah, it's interesting you bring him up because he's very intriguing for sure. Like I'll listen to him, and a lot of it goes way over my comprehension level. But what I love about him is he's not afraid to throw it out there and take the criticisms that comes his way as well.
Yeah, yeah, yeah. Well, he's a scientist, and we're born as a little baby scientist. I always tell people I was a physiologist before I became a cardiologist. I did a PhD, and if you don't learn to get thick skin there, buddy, I mean, just forget about it because I mean, everything you say is questioned, and so I love that about him too. That he brings all that experience and says, if I can't defend what I think is true, what am I doing saying it? If I can't,
Mhm.
withstand a couple questions here and there, maybe I should rethink this. But everything is at risk of being questioned. Remember, there was not too long ago, several hundred years ago, that if you had a fever, we would just cut your vein open and let your blood drop into a pail. They called it bloodletting.
Yeah.
And we figured that that was not the right thing to do because many people were, super pale, can't think straight, but you didn't have a fever anymore. So, everything should be at risk. What we think is true now, across every different line of thought you can think of, is at risk of being changed and some new thinking. I love that a scientist could be part of the people, the professions to help us think differently about existence. So, yeah.
It's funny you mentioned that. I was just doing something the other day, and one of the messages I had for our community was to go live curious today, like be ultra curious.
Mm,
Why did Dr. Dave come across my field of view today?
yes.
What am I supposed to learn? What am I supposed to teach? What
Mm,
if I'm wrong and everything I think I already know?
yeah.
Would I
Yeah.
listen differently to you?
Yeah. Isn't that amazing? Not just learning, but also teaching.
Mm-hmm. They're hand in hand.
Yeah, no, it's critical. And I think this idea that um we would go through some of our long held deepest, closest thoughts and ideas about things and people in life and just be willing to let it be raked over the coals so that we can evolve. Boy, that's a fantastic thing. I'm trying to teach that here at my office that although it doesn't feel amazing to be coached on something as you think you're doing it right, and sometimes you get coached and you run to this idea that what you've been doing is not correct. Sometimes that can be, that can hurt your feelings a little bit, but if you'll allow yourself to be human and say, okay, yeah, my ego gets bruised by that a little bit, but then I'm going to be better. So the people who strive to always be better are people who can be coached, but then also not afraid to also coach. That's the other thing. It's a bi-directional thing.
Yeah.
And it goes way beyond us how we're taking care of patients. It goes to what you're saying, it's just everyday life. If I'm willing to learn from you, Jared, boy, my life can be different. And I evolve from the caterpillar to the larval stage, and boy, I'm almost there. Boy, just a little bit longer, and I'll get there. To the butterfly. So yeah,
Yeah, no, and I love it. And that's such a like you mentioned earlier, the divisiveness and some of the climate of society nowadays. That's one of the ways we combat that is not being held so hard to our beliefs
yeah,
that we're not open to see anybody else's, and we're not even willing to discuss it with each other and learn from one another. Because as I've gotten older, what I've realized, Dr. Dave, is I'm wrong far more than I'm right about anything.
yeah, yeah, right. And when you first come across that, you're like, holy moly, like, what have I been doing?
Yeah, man, I want to
And
go back to my decade of the 20s because I thought I knew so much. And now I'm like, dude, you were wrong about so many things.
that's right. And guess what? We all get to go through that.
Mm-hmm.
And that is a beautiful thing that we get to go through that. Listen, and it's painful. I mean, I don't know what the caterpillar feels like when it kind of balls up into that thing, man. You know, they go from the pupal stage. Like, that's got to be painful. But you know, the next stage is more beautiful still. And if you will just keep going, you'll arrive. You'll arrive at that fully evolved person, man, who, I mean, we've heard plenty of stories where you've got people with these like staunch draconian views, and then somewhere in their lives, they realized that it's just the unified field and we're all really just the same. Like, it's mind blowing. Like, we really are the same. And when you get to know somebody, you're like, man, you know what? I would actually think like that too. Like, that guy's like me, you know?
Yeah.
But we just have to take the time to do it. I think some of the friction and why things aren't going is because we're fighting against something that we're intrinsically, innately, how we are. If you're a certain way, but you keep fighting against it, your course is going to be rough. If you go against the grain, it's harder.
Yeah.
If you go with the flow, the natural flow of life, man, you can go far. And it's less of a taxing thing, right? So anyway,
No,
I'm droning here, Jared.
no, I love that, because you're absolutely right. That is one of the defaults, I think, in Western society, you know, mostly, is that we try to control all the things that are really uncontrollable in life. And we spend so much time trying to control things that we have very little input on.
Yeah.
And if we'd release that, like if we'd release the fact that there might be traffic today, it doesn't need to cause me stress. Like it's just part of living in the city.
Yeah.
We release that maybe our neighbor's dog's going to come in our yard. It doesn't need to be the end of the world, right? Like we have all these things we can't control, but we put so much energy in that. And then what we can control, like our health,
There you go.
we don't.
We don't
Or
do it.
we kind of just throw it out there and be like, well, we'll just see how it goes. And that's kind of where I wanted to transition here, is what inspired you to bring the Prevent clinic to life?
Yeah, that's such a great question. And, you know, I sometimes pause because I had to really, you know, when people say, you know, what's the origin story? I had to sit down and think about it. Literally had to write some notes because it's easy to just go about life, right? But when I was training at Northwestern in Chicago, my medical training, I was in my residency. This is before cardiology. And because I knew I wanted to be a cardiologist since grad school, before that, I was just keen on everything cardiology, right? So just, you know, just prick up my ears on anything that came across. And what I learned very early on was that heart disease kills more people than any other condition in this country and many other industrialized countries. But here's the kicker. We know how to stop heart disease from killing people, partly because we know what causes heart disease. Now think about this. It kills more people than all the cancers combined. And that blows people's mind when you hear it. We don't know what causes many of the forms of cancer. Right. We sort of give a general basket of, you know, when we hear about a celebrity or something on the news who has cancer, well, what are the things I should look out for? It's generally, you know, lifestyle things, just general. We don't know on the cellular molecular level just exactly how that happens. And so it makes sense that we still don't know how to save people from the cancers, many of them. We know exactly what causes the commonest killer of people from a heart disease standpoint. Exactly. And we know, and we're doing it now, how to stop people from dying. Something is wrong when you kill that many people, when you allow that many people to die, I should say.
Right.
But you know how to stop it. But then, so what's the answer? Because as a scientist, I was always prone to ask and try to answer questions. It's the scientific method. That's what we do.
Right.
And one of the things that buoyed to the top in all of my sort of machinations around this thing was that we don't test people enough. That in the American healthcare system, we would rather save $1 than to do a test or to make the test more affordable. And then once we find the disease, we're not aggressive enough. And that's really nuanced. I'm sort of zooming out, but that's exactly what it is. And part of the reason is because we don't want to use certain strategies to help people prevent it. But that's also a failing of American medicine. And so I just decided I couldn't be a part of the cabal, right? And just do things the same way that we've always done it. And it was in the, you know, you kind of get this desire that just won't leave you alone, right?
Yeah.
And it just kept coming since residency. And literally, I think Providence, the universe, God is like, listen, you're going to either do this, I'm going to make you physically ill. Yeah, I got physically ill. I was like, all right, I'm going to do it. I'm going to do it. Okay. I'm going to go and open this thing. And I was scared to death because the industry was going in the opposite direction. There were no little groups, small private practices coming, popping up. They were being absorbed. They were being
Yep.
bought and purchased. And because of that, you are a part of I'm using the word cabal. But I did it, and 3 months into it, I was like, why didn't I do this 5 years ago? It's funny how that works. And then we started to see that it was successful, not because of Dave Montgomery, but because it was an idea whose time had come, that
Mm.
people have been looking for somebody who's just going to test them. And when they get tested and find them, they're going to be super aggressive. And that's what we did. So that's the origin story there.
I love it. Let's talk about facing that fear of going to be different. Because I think for all of our community, no matter what they're facing today, that courage to be different is going to be tested.
Yeah. 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 I'll tell you, boy, that brings up so many things. I'll start with this story. When I had decided, I remember when I went to the federal website and I got my EIN. This was January of the year that was it. I said, if I'm going to get this EIN, I got to do it, right? So once I got the EIN, I started planning and strategizing. And I also planned when I was going to tell people. When I started telling people, my colleagues, the vast majority of them were like, what are you talking about? Why would you do that? Like, one of my closer colleagues, whom I still hold dear, said, but what's the benefit? And I said, the benefit is I get to practice in the way that I think. But no. What's the benefit? I mean, she was angry. Okay.
Yeah.
And I said, no, really. Like I get to, no, what's the benefit? Like, so, it just didn't click to anybody else. And I said, it's not my job to try to convince everybody else of this. It's my job to focus on what what was before me to do. And it was very clear that this was my, it sounds hokey, doesn't it? Destiny. Like I had to do this. No. And it is being different. And so some of those people, we're not friendly anymore. And I couldn't understand why. And my wife said, maybe it's a reflection on them. I was like, nobody's reflecting on anything that I'm doing, but maybe it is. Maybe they feel like it's a reflection on what they're doing. I don't know what it is, but being different takes courage. Mm-hmm. It is lonely. If I could say this at the top, it's lonely when you're at the top of an idea. Mm. It's lonely when you're at the first through the gate, and you're going through that fire. But it is also worth it when you know that eagles soar alone, and only those heights that an eagle can fly are for an eagle. Mm. And I guess I'm doing eagle stuff. I don't know. It sounds ridiculous when it comes out of your mouth, but that's what it is, I think.
No, and I think you're right. I think what are your thoughts on this? That it's lonely if you get to the top and try to stay in the same circle with people that didn't also want to come to the top. But if you get to the top and you embrace a new circle, you're going to find other eagles come up there too. That's
right. You'll be among eagles. You'll notice that there are many other eagles when you get up there. It's like if you buy a green car. Oh my God, all these green cars. I never saw so many green cars,
Yeah.
And it is, that's exactly right. I would agree with you there. Absolutely.
Yeah. And I love having the courage to be different. I love having what you said there is you felt like you had to do it. Like you just would go to sleep and it would tell you like, you better do this.
Yeah, no, I physically became ill. Like it was visible. Wow. Okay. So in just a very short line, one of my eyeballs stopped doing what I wanted it to do with my brain. It just started going inside. And I went to listen, Jared, I went to every doctor you can imagine. I had every scan, MRIs. They were poking needles in, doing what they call single fiber studies, with these little things, trying to figure out what it was. And I started, this was my first year of doing purely plant-based, all vegan, no processed plants. And in that was also a period where I had to do some introspection and started sort of weeding things out. Kind of that thing which you were talking about, controlling. Like, stop trying to control things you don't have any chance of controlling. But also in that stillness, in that quietude, I found the message was, you want to come back to this idea we've been talking about to you inside your head for the last 15 years? And boy, I literally, as soon as I decided to do it, I got on this vegan diet, the eyeball shifted back over. It's not completely normal yet because it's like, I'm just going to remind you, buddy, okay, that if you don't keep on this road, I'm being a little bit silly, but I literally was physically ill, and it was visible, right? And whether this is a part of some higher plan or not, I took it as that. And when I started doing what I was supposed to do from this message that had been there for so long, the illness went away, and I started being able to control what I can control, what I am to control. Um, you know, it's interesting because if I go back even further, I started off with the idea that I was going to be a bench scientist, a basic research scientist. I did a PhD in physiology and biophysics department at the University of Illinois in Chicago. And my dream was to not just be a clinical doctor, but to also be a researcher that's at the cutting edge of cellular molecular discovery.
Yeah.
And I was very fortunate. I had some fantastic mentors. We were successful in that realm. Published a lot. We started publishing early, first authors, all of the things. And I started my clinical work with the idea that I was going to do that. And then I realized that although you're good at something, it doesn't mean that that's for you. Although you can do something well, that may not be your jam. And when I started listening to what my jam was, when I say listen, with that internal listening, being still, I realized that I would often get into the flow state when I was with patients. Forget about what's going on. It's like the poem by John Yao about Jackson Pollock. You remember the movie about Pollock. Pollock would just go into this different zone. And in the poem, he says, when I am painting, I am not doing what I am. I'm in what I'm doing. When I'm painting, if I'm doing what I am, I'm not in what I'm doing. And I'm like, and the poem is like really deep. It gets real deep. But I mean, it makes your spine tingle. I'm like, that's exactly it. Like when I forget that I'm a doctor and just doctor, it's unbelievable. And the feeling, like yes, you're helping people, but at the same time, you are getting fed. It's a soul level thing. And I said, who doesn't want to do this all the time? So it was hard for me to break with this idea, for me to change my mind about what my career would look like, that I'd spent this time in research and understanding my philosophy about science and medicine. And, somebody said, well, you wasted all that time. It wasn't wasted at all. In fact, I'm using it even today as I'm talking to you, just the reasoning and the thinking and my philosophy about life. And when I decided I was just going to focus on what I was supposed to do, then all of that made sense now. That I had to get ill because you're going to try to be some, bench scientist. No, I don't want you to be a bench scientist. I want you to go and sit with people, whether it's on a large scale or on one-on-one, and deliver a message that I'm going to use you to be a vehicle for. That's what it was.
Oh, that's amazing. And there's a couple of things that really stand out to me. Now, first off is that just because you were successful didn't solve your appetite to be something different, right? It's okay to walk away from being successful in one area. It doesn't mean we can't do multiple things. And it's weird that people sometimes get hamstrung by their success.
Yeah. I think it's also a fear, and it's how we're, the people around you, because I went to medical school, as an aside, I went to medical school with some really good, smart people who wished that they could be concert violinists. and they were really good. Like, I mean, when we would have our talent shows at Northwestern Feinberg School of Medicine, let me tell you something, man. I mean, and you'd be like, that dude's in a flow state, like he is jamming over here.
Yeah.
But they didn't do that because, maybe somebody told them, you must be a physician, you must be a surgeon, you must be so I think that's more common than we think.
Yeah, I think absolutely is. I think it's weird, right? Sometimes we got people that are like feel hamstrung by their shortcomings or their failures, and they carry them with them throughout life, and they can't release it. Then we have others that are hamstrung by their success, and they won't go be who they want to be because they've had success maybe in another area that they didn't choose to be, or they were pushed to.
Yeah.
And then what happens at the end of life there?
Yeah, boy. I mean, and that's big because, I think, it's a societal thing as well. We just have these occupations that we just think, you're supposed to do this. And there's certain, families that listen, you have to be one of four things.
Mm-hmm.
And that comes from, historical reference, like their historical reference. And I understand that. But how many examples can we point to across sectors, industries where somebody decided, waste management, for example, somebody just said, I'm going to be the best darn waste management garbage guy that you could ever imagine. Like and that's $1 billion company. Like you know what I'm saying?
Yeah.
Like somebody is making, do you remember I forget the story of this Post-it thing. Somebody said, I'm just going to make this Post-it.
Yeah.
Like whatever you are to do it. Henry David Thoreau says, we are constantly invited to be what we are, as to something noble and worthy. I never, he says, it's really important how I get this part. He was talking about being deterred from it. No one ever deterred me from being who I'm supposed to be, but I still lagged and I tagged after that thing. So we're constantly being invited to be exactly who we're supposed to be. And that thing that was, yearning in me, it had to be birthed. It was an idea whose time had come. And I'm still searching, can I still be who I am to be, who I can be, who I should be? And that's part of it. So
I love it. And I love your story that this purpose in your life, that this drive kept coming back to you and even caused medical issues for you to really push you that way. How important is having a purpose in our lives and having a reason why we're going to sacrifice and move ourselves forward and maybe face our fears, so important, not just for our lives, but our health and our well-being?
Yeah, I wish I knew the answer. I'll say, this. We all have one. And I think that's what ties back to this idea that not everybody's supposed to be an orthopedic surgeon.
Mm-hmm.
That in fact, there is a really important place for a concert violinist, or else we wouldn't go to the symphony, or else we wouldn't have, the scores of movies with violins in it. There is somebody, believe it or not, who's supposed to be a center on a basketball team, or else we wouldn't spend billions of dollars going to watch it. There is somebody who's supposed to pick up the waste, or else we live in scum.
Yeah.
Your purpose is there. And I think, how do you find it? It's not a finding. It's an uncovering. It's an unfiltering. It's there already. And you can just hearken to it when you find yourself doing something that you lose time with. That flow state, we talk about the flow state, when you just forget about what's happening. Now, I had a debate with somebody, what if I'm playing my video game? Well, it depends, right? If you're playing a video game and you're within the game and you're, experiencing that game very differently than somebody else, you're supposed to be a gamer because there's something there. There's a place for the person who's supposed to be a gamer, or else we wouldn't spend millions and millions of dollars on games. Do you see what I'm saying? Mm-hmm. So whatever really jazzes you and you lose time, you're like, oh, let me hurry up and get out of here, right? That is the breadcrumbs follow them to what you're supposed to do. And no matter what it is, if you will just acknowledge it and just say, boy, maybe let me just explore this just a little bit. What harm would it take or would it do
Right.
if I just explored this a little bit? So I don't know that larger question, but I know we all have one. If you fight against your purpose, it's like fighting against who you are. We're constantly invited to be who we are. Why? Because we're supposed to go through this evolution from caterpillar to larval stage to pupal stage to ultimately this beautiful butterfly. And if you don't do it because of the fear of pain to evolve, then you don't survive. Like you don't really thrive like you could be. And so you become physically ill. Things seem just so hard. Every facet of life is really, really difficult for you because you keep turning your back to what you're truly here to do. And boy, I think it's more common than we think. But yeah,
And that ties back to energy, right? If we really accept that we are all energy and we're spending our energy fighting against things,
yeah,
well, that's the energy we create, right? So then our body thinks it should fight. Is it
yeah,
fighting against itself, right? Are we causing our own health issues?
absolutely. Because every thought you think, if you talk to the neurobiologist, every single thought you think has a biochemical footprint, right? So if you think negatively about yourself in any vein, for that moment, you are that thing. Like it's not just a quote. As a man thinketh, so is he. Period. That is a physiologic truth as much as it is a soul spiritual truth. It is very true. That if you continue to think that you're not worth it, I can't believe myself, why am I such an idiot? If you think the words, why am I such an idiot? The biochemical footprint of an idiot is released in your body.
Mm,
The more you think that, the more you release that biochemical footprint. You keep doing something and you become that thing. You keep thinking something, you become that thing. You keep saying something, whether you say it internally, much more than you say it outside, or you say it outside, you become that thing. And that's an internal job. Health is an inside job after all.
right.
I'm writing some stuff now, and health is an inside job is one of the section titles. And the truth is, we look outside ourselves very much when it comes to health. We start, we say, exercise more. We say, get some sleep, eat less, I don't know, potato chips for me, right? But we're missing the core, and that is the way that we view ourselves, the way that we view life and our health. And when we think about it on a basic level, it feels very otherworldly. It feels sort of mystical, right?
Mm,
Oh, I can, it's like the mind body connection it freaks people out, right? But the truth is, we're doing it all the time, in little ways, medium ways, and big ways. We're doing it all the time. We're realizing that what we process inside ourselves becomes who we are.
mm.
And if you go through traditions, I mean, there's all kinds of people who've said this, right? Um, Buddha says, what you are is a result of what you have thought. It's a long quote, right?
Yeah.
You think about that. So if you maintain and you keep an illness, then it's because you've attached yourself to that illness. And that's a really hard thing that's a bitter pill. If you don't focus yourself, because let me back up for a second, because that's nuance. I'll just say this because I'll take up too much time. There's two ways to not use your thoughts properly in this. You can misuse them. Why am I such an idiot? I'm fat anyway, so I don't really care what I eat. I'm just going to eat
Mm,
anything. Or you cannot use them at all. You cannot use your thinking to exact the kind of health changes you want. Now, I'm not saying it's easy. I'm just saying that happens a lot. But the flip side is also true. We've all had the very beginnings of a cold, and we've decided, nope, I'm not going to do it. And what do? You go do whatever you want. I don't care, but you can drink vitamin C, tea, this. People have all kinds of concoctions, but you know what the through line is? You know what the common denominator is? that they think and hear that I will not have this cold. It's not going to happen. Guess what? The biochemistry of a bolstered immune system, an endocrine system that's fighting, becomes who you are. And whatever that infection was gets defeated faster. We do it in small situations like that, and we do it in big situations. I have many patients who have been diagnosed with fatal cancers, and you'll see them and they're like, hey, how you doing?
Yeah.
Life is great. Now, did they have to go through a process? Yes. But they are who they say they are. They are who they think they are. And guess what? Those are the people who have the incredible recoveries. You were supposed to die 10 years ago. We've heard this over and over again. There's something there's a common denominator there, and it's not for special people.
Yeah.
It's not only for special people. So.
Yeah, I love that. I was watching a special on the blue zones.
Yeah.
And
Buettner. Yeah.
Yeah, and one of the people they interviewed was like, how did you live to be 102 or whatever? He's like, I just didn't know I was supposed to die. You know what I mean?
That's exactly right.
He didn't wake up every day going, oh, I should have been dead today. He was like, I'm alive. Like, I expect to live.
Yeah. Yeah, I think that's true of many people who have those long lives, that they have imagined for a long time that they would live for a long time. I don't think in any way that you put it. So they either say, "Hey, listen, I'm just going to be alive today. I'm excited to get up today. I'm excited to go and be a part of the community." Dan Buettner kind of highlights this idea of ikigai, right? This Japanese concept and the moai that develops around having meaning. In a community, like they need me. Let me get up and do this. And I'm 98 years old. Let me go to the rice fields, for example.
Yeah.
And I also think the opposite is true. This is a misuse of your thought when you use it in a poor way. When people think that because there is diabetes in their family that they have to have it and they're probably not going to live very long. So then they don't make the right choices. And guess what? They don't live very long.
Right. How important did you say community is for as we age? Community is for our overall well-being.
Yeah, no, that's big. I think, and I'm learning that, as well as you are from people like Dan as he goes around, and to these blue zones. And if we look back into the literature, we'll see, for example, it just came out that grandparents who live close to their grandchildren live much longer. They have a purpose, their meaning, although it changed from when they were hustling, bustling like you and I in our younger years. Their meaning is now different, but it's still meaning nonetheless. That this idea of having a purpose is fuel for life, right? Boy, I tell you, and if you can attach yourself to a purpose, you can retire from a really difficult job and still have meaning and live a really long time. So I think there's a lot there.
Yeah. What do you think on this, Doctor? What do you think having a current purpose, right? Not holding on to what I used to do, right? Kind of like you said, that's a misuse of my thoughts. Like I'm holding on to what I used to do, but finding one today, or giving myself permission to move on to a new, what is it that fulfills me today? And
yeah. No, I didn't mean to cut you off, but no matter what that is, if I'm gonna travel the world, like I have a purpose. My purpose is to enjoy the fruits of my labors of all of these years, no matter what that is. Some people just want to give all of their money away, we hear of stories, right, of people who've done some fantastic things. Carnegie, for example, right, who poured into Napoleon Hill. Everybody knows Napoleon Hill. Napoleon Hill tells that story. Right. Of this man who just poured into him. He didn't have to do that. Are you kidding me? But he did. And just finding what that purpose is, no matter what it is. But being deliberate, and the word that everybody uses now is intentional about having one, right? So,
and one of the things on purpose is sometimes I think we try to make it too big, right? Like my purpose is to put somebody on Mars. Well, maybe your purpose is, like you just said, to run your grandkids to practice so they don't miss their sport.
Yeah.
Because maybe that grandkid's going to become the next Michael Jordan and change the whole trajectory of family genealogy for generations.
Yeah. 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 No, absolutely. That's a very human thing,
Mhm.
putting magnitude on things, small, medium, large. But, divine mind consciousness it doesn't know anything about size, which is why when we do these incredible things, like somebody, lives for 20 years past a diagnosis, a fatal diagnosis, and we were like, oh, that was amazing. Well, it's really a part and parcel of the same power that we all have access to in this unified field of consciousness. That if we would just realize the truth, remember this part in the Matrix, there was a scene. Remember when Neo went to see the Oracle? This is when he really was going to be told, "Listen, you've got something, kiddo," and he was sitting in the waiting room. It's not a waiting room because this is a home. He was sitting in like waiting for the Oracle, and there was this kid that they called the Young Potential, and the Young Potential had the spoon. And you remember this? He's bending the spoon. He wasn't he right? And obviously, we're all looking at how's he doing this, and he says, "Do not try and bend the spoon. That is impossible. Rather, realize the truth." And Neo says, "What truth?" "That there is no spoon." "No spoon? What are you talking about?" "Then you will see that it's not the spoon that bends. It is only yourself."
Mm.
Holy, holy, your spine tingled. You're like, me, right?
Right.
That's exactly. And in the Matrix, just like many other stories that we've heard throughout the years, it's not just about Neo, it's about who we can be. And this idea that if we would just open up to whatever that is, our current purpose right now is doing what you and I are doing.
Hmm.
We've never met before, but there is a purpose in what we're doing right now. And guess what? We're in a flow state, you and I, on purpose.
Yeah.
It's beautiful.
So what are a couple things you'd recommend for our listeners, actionable steps they could do to either assess their cardiovascular health or start working towards improving it?
Yeah, we didn't talk very much more about cardiovascular health because we're having I think a really great conversation. But everybody should go hire a doctor that they trust. There's a lot of reasons to be dissuaded from doing that. The healthcare community, the group of professionals that we are, have earned the distrust that we're labeled with, and it's
Mm.
our job to get it back. But for you and your family, you want to be the healthiest you can be. So go find somebody you trust to help guide you through this maze of craziness that's out there, right?
Right.
You want somebody who's been trained. So go hire a doctor you trust. And when you get there, go get your heart screened. And not every physician is going to send you for a heart screen. If you are over the age of 40, go get a heart screen. I think that screen contains three things: a stress test, an echocardiogram, and something called a coronary calcium score. Stress test is generally on a treadmill, but there's different ways, and we're testing blood flow, electricity, and exercise capacity. The echo or echocardiogram is a heart ultrasound. We're looking at the inside of the heart, seeing if there's structural abnormalities. We can catch things early. And then the coronary calcium CT, you get a plaque score. How much plaque does he have or does she have? And if there is some there, what's the score? How much? What's the magnitude? And when you get those and there's an abnormality, the last point is do something about it and be as aggressive as you can
Mm.
because it is the number one killer, but it is preventable.
What are the basic things I can do in every day? Right. Obviously, exercise is a big one.
Yeah. What I want you to do is when you wake up in the morning, I want you to be thinking about health.
Mm.
We say health is your wealth, but I'm not really sure we do that. We get up in the morning and many of us grab our phones, and we're off to some other place.
Yeah.
One of the first things I would advise you to do is take a moment just to be with yourself in some kind of mindfulness, whether you just sit, whether you on purpose meditate, whether you plan your day, whether you take out a sheet of paper or you start typing and do what Julia, what's Julia's name from Artist Way? Julia. So she calls the morning pages, right? Morning pages. Just
Yeah.
start writing. It's a mindfulness technique. um, and focus on your health. What am I going to do for my health today?
Mm.
What am I going to do to be the healthiest human being that I can today? What's my plan? And if you have a plan, in that plan is going to be, what am I going to focus my mind on? What am I going to think? What am I going to fuel my body with? What am I going to eat? And what am I going to do with my body? How am I going to challenge my body today? How am I going to exercise? Then, how am I going to rest? How am I going to let my body take whatever happened throughout the course of the day and repair itself, restore itself so I can do it over again? And the more and more I do that, the more of those days I'll have. The people who focus on those things, as we see in these blue zones, are the people who have more life, right?
Mm.
They have more life, and that's the key. Focus on your health when you wake up in the morning. Then go to scrolling. Scroll
Yeah.
later
Yeah. It's always going to be there.
for the rest of time. Okay.
Dr. David, it's been such a pleasure to have you on the show, my friend. Where can our audience follow along in all the good that you're doing for the world?
Yeah, no, I really appreciate being here. You can contact me best on social media. It's sort of the portal to all of our other outlets. If you go to Instagram and Facebook, it's The Good Dr. Dave, The Good DRDAVE. And then we have a podcast. On a podcast, it's about health, wellness, and mindset topics. And we do it in sort of a relaxed environment for an expanded audience. And that's called the Health Mastery Cafe. So you can find us on YouTube, the Health Mastery Cafe. You can find us on Instagram, Health Mastery Cafe. And let's connect. Let's have more conversation just like this.
Thank you so much for joining us today. It's been a true pleasure getting to know you, my friend, and I can't wait to see what you do in the future.
The pleasure's been mine, Jared. Thanks so much.